Welcome, everyone. Thank you so much for carving out some time from your very full schedule to join us yet again for our monthly panel on redesigning the future of work. When the pandemic began, it's now 28 months ago, Inspire was hearing the same questions from everyone in our network, clients, folks were up nights and weekends trying to solve the same problems. And we thought, let's just get them all together so we can crowdsource this information. So we launched these very sessions, and you can listen to our episodes, past episodes, if it's helpful, on our website, or you can always download wherever you get your favorite podcasts. They're all in our podcast, which is called Inspired, for those of you who want podcasts on the go. For those of you, I see we have lots of new folks joining us today. For those of you who might not be familiar with Inspire Human Resources, we're thrilled to be celebrating our 15-year anniversary this year. Since then, we've steadily grown. We have a team of 30 plus HR experts who are kind of senior and mid-level, and we help both heads of HR and heads of companies, CEOs, chief people officers, for the 4 core HR areas, which are HR business partner, talent management, talent acquisition, and total rewards, always with a lens on DEIB. And we help companies in 2 ways, either kind of parachuting in to provide interim experts should someone be out on a leave of absence or a tough to fill spot that's been open too long, or companies also bring us in to be an embedded resource for very lean teams trying to get work done or building HR infrastructure. And we have folks on our team across 12 states. So thrilled that so many new folks are joining us today. Now more than ever, we're seeing the value of fractional work. We speak to so many companies who in these volatile times really look at their talent supply as a mashup of both permanent as well as fractional resources, which is very much what we do. So thrilled that after 15 years, the working world is very much working in the way that Inspire has always trailblazed. So now it's time to dive into equitable rewards. So boy, are we at a moment. Salaries are on the rise. Pay transparency actually is going into effect here in New York, where we are, and soon elsewhere across the country. Many HR leaders are going to find themselves grappling with the very same issues, right? It's how to use their benefits offering to promote greater equity, how to provide equitable compensation. So in short, if you find yourself in the fun job of total rewards, there's an awful lot on your plate. And that is exactly why we've assembled this panel of experts to walk us through some of the key areas that everyone is facing. We are in great hands today. We are joined by Lacey Horn, who's the founder and CEO of Native Advisory, which is a strategic financial consulting firm working with Native American tribes, helping them achieve true tribal sovereignty. Chuck Privatera, a vice president in the Workplace Solutions Group at Goldman Sachs called ECHO, and he there is a relationship manager and business development executive. Ray Goldberg joins us. He has deep experience leading and consulting in HR benefits, technology, and HR operations and transformation at large companies, including CIBC, Deutsche Bank, Lucent Technologies, and Marsh McLennan. And Lori Glaskell, she's an expert, our very own expert on the Inspire HR team that specializes in compensation. So with that, thank you again, all of you, for joining us, and let's go ahead and dive in. So Lacey, as our CFO in resident here on the panel, I'd love to have you help us really set the table for the discussion. So when we're talking about compensation and benefits, it all sounds fantastic when it comes to retaining and attracting folks, but this all comes at a cost. So we'd love to hear from you to kick it off. How can CFOs and CHROs work together and collaborate to really budget for financial, medical, and mental health benefits? So as a CFO, do you have any tips for HR leaders advocating for larger budgets and making the argument clear for these inclusive benefits?
Absolutely. And hello, Jamie, and thank you so much for having me today. Yes, cost is certainly something that is on everyone's mind, from you and me at the gas pump and at the grocery store to CEOs and CFOs trying to lead and manage the bottom line. And there's no question that taking good care of our people through an array of benefits is a necessity, not only from a recruiting and a retention perspective, but it's necessary to support your employee as a person. And benefits can be expensive, and they can also be inexpensive. And it's going to be important to strike the right balance and to be able to offer the right benefits at the right price that are right sized cost wise for the organization. And so first I want to, first recognize how important benefits are. And then I want to give you some insider perspective on some thoughts your CFO is having right now. So for one, we are in a period of significant inflation. So we're not quite yet at hyperinflation, but we're getting pretty close to it. And the last period that we had like this was in the early 1980s. So it's pretty safe to say that no working CFO alive has managed through a situation like this. And from a global macro perspective, it's just wholly unique and challenged, as we all know. So your CFO first and foremost needs some understanding and a bit of empathy, because they're concerned with budgets, expenses, revenues, investments, interest rates, and so much more right now.
They need some love. They need some love, right? Right.
They need love. And so, yeah, and then they need you to do some work for them. They need to have support for what you want. So the data, survey statistics on how these revenue producing positions that you're seeking to hire and incent with necessary benefits will have that direct positive impact on the company. And then also let them know that you've done an inventory of the benefits and that what you are offering are relevant and are being used. And then finally, help your CFO make sure that they are fairly priced. And we're seeing this a lot with companies that are putting out their outlook projections, and they're saying that they are intending to protect margins at all costs, which means that they intend to keep raising prices because it's resulting in profits. And so that means it's a great time to consider bidding out your larger benefit packages to ensure you're getting competitive pricing in this market, because some companies will try to maintain that competitive edge. And so I think following these 3 steps will lead to a very transparent conversation with your financial leadership on why exactly you need what you need, while also showing them that you're helping them out by being proactive and looking for cost savings and increased revenue production.
I love this. Hashtag show the CFO some love. This is such good perspective. So with that in mind, Chuck, I'd love to get your thoughts. How is financial wellness an equity issue? I know you are crazy passionate about this, as am I. And, how should total reward pros, what should they consider before designing and evaluating all these financial wellness initiatives?
Thanks, Jamie. Great question. I am very passionate about this topic. Financial wellness, the phrase is about 10 years old, and it's early. It's in its infancy. It began around the idea that financial stress is causing people to get physically and emotionally ill. And this was a problem for obvious reasons for workplaces. And so something that needed to be addressed. And so since then, the phrase has been really diluted. And it's gone away from actually helping people feel better about their finances, and specifically around DEIB. I had the fortunate accident that working with a client in 2015 that had asked for various reasons to look at some data around their 401k plan based on gender and race. And, I'm the old white guy in the room, and I was like, wonder why they want to do that. And shame on me, but something I couldn't unsee. It was white guys across the board saving more money, dollar amount, percentage, balances. And a lot of this is certainly tied to compensation, but not all of it. And so I went on a crusade from there. This is the me that you've gotten to know that is unrelenting in trying to determine, what are the issues. And the number one issue that I found was that, in addition to the messaging and all the pictures of white people and things like that, but has anybody ever asked people what their number one savings priority is?
Right.
And so once those questions started getting asked, the answers were very different based on race, gender, sexual orientation. So so this is new. This is like 3 years new. You put pre George Floyd, but those conversations were happening, and people are like, oh, interesting. And then 2020, people are like, oh, this may be more important. And let me sort of explain why I think it's important. And I think it should be obvious to many on this call that companies are making an effort to hire and promote and do all the right things from a diversity perspective.
Mhm.
But if employees come into the workplace and say, this is a white guy benefit, or if my financial wellness plan is to max out my 401k,
Mhm.
but my number one savings priority is first-time home ownership, or educating a loved one, or caring for adult parents,
Mhm.
or more concerned about income for my partner if something should happen to me,
Mhm.
then the financial wellness message is not an inclusive one.
Mhm.
And so, some of the work that I've been trying to do is trying to figure out how do we put into place financial wellness programs that are more inclusive, more thoughtful about the entire audience that we're trying to serve,
Mhm.
especially conversations around lower and middle income employees whose
Mhm.
number one savings priority may be to meet my monthly obligations.
Yes.
My attention there is, look, if you're going to talk about maxing out your 401k plan savings contribution to a group of people that are just trying to make ends meet,
Mhm.
you're actually causing more stress. That's
Sure.
not a financial wellness conversation. And one last thing that kind of breaking news, I get a lot of data from a group called the Financial Health Network, and they had a report on workplace debt. And basically what they were evaluating is the stress levels for employees that were what they call in crisis mode when it comes to debt. So that would be 25,000 or more of non-secured, credit card debt. And this was a unique report, but then buried on page 12 was something that just sort of crushed me. And it was of people who are in that crisis situation that have access to a coach. 64% of men took advantage of that, and only 39% of women did. That's a staggering difference, and it got us moving quick. And so, we've, at Goldman Sachs, we're like, okay, we got to talk to product. We have to talk to our,
Stat.
we eat our own cooking here. So I went to our financial wellness team at Goldman and said, are you aware of this? Has anybody looked at this? So I think for Total Rewards Pros, it's about not just, plugging and playing a financial wellness digital
Mhm.
solution. It's being really thoughtful about the audiences you're trying to
Mhm.
reach, what matters to them. And there are several ways to bring in different types of solutions that we're learning more about every day. But yeah, it's not just about, okay, let's check this box anymore. It's about making sure that it's part of our inclusion strategy, and that it actually is helping people, relieving stress that's related to their finances.
I love this. It's such a great insider perspective. And one of I'm hearing 12 takeaways, but one of them that's sitting with me is ask your employees, what is their priority? Don't make the assumption that it's retirement. And
Absolutely.
yeah, so important. And I'd love to now dive into inclusivity when it comes to benefits overall. So with that, we have our resident expert here, Ray. So Ray, this one's for you. How can companies and HR leaders, what can they do to advocate for more inclusive healthcare benefits, especially for members of their team that are from traditionally marginalized communities?
There you go. Just proving that none of us can get it right when it comes to Zoom and mute.
It's all good.
Jamie, thanks for the question. I want to talk about two kinds of marginalized communities. I want to start with those with a transgender identity or a non-binary identity. I know we've got some attendees on the call from Canada, but I'll share one stat that blew me away, which is that in a recent survey in Canada, 45% of trans and non-binary respondents said they had an unmet health need in the past year. Okay, but that was compared with only 4% for everybody else. So it's a huge gap.
Massive disparity.
I was surprised that the 4% was as low as it was, but I was also surprised that the 45% was as high as it is. And only half of those non-binary respondents said they were comfortable discussing their health issues with their primary care provider. So one of the things that we need to be doing is making sure that our plans certainly provide for gender affirmation surgery, including hormone therapy, including mental health,
Mhm.
including cosmetic procedures that may be necessary to go along with a change in gender identity.
Mhm.
And to make sure that there are providers in our networks that are skilled and competent in these spaces. Some of those are easy to do. Some of those are really within the direct control of HR or its benefits provider. And some of them are hard to do. We can't, as individuals, sort of radically change the prevalence of mental health professionals who with skilled transgender experience or skilled Black experience in our mental health networks, but we can be pushing on our providers for them to expand those networks. The second thing I want to mention is a broad point, and it's sort of like the similar point that what Chuck was making, which is some of these differences may apply by race, but some of the same ideas will apply for everybody. So there are lots of health gaps for people of color,
Mhm.
huge discrepancies in terms of heart health, in terms of diabetes, in terms of cancer detection, in terms of cancer mortality, et cetera, et cetera. So one of the things that we should all be doing is sort of leaning in on health management, on disease management programs that are pretty well understood, actually, but pushing to get those out to people, pushing for utilization. That will, by definition, have a greater impact on populations that are having a greater problem,
Mhm.
but those will benefit everybody. So for
Mhm.
those to get a little bit of the heebie-jeebies around saying, gee, this is a program directed at one population, this is a way to go at everybody and still have a disparate positive impact for
Mhm.
those populations that
Mhm.
have it worse to start with.
This is fantastic. Again, I'm getting 11 things that are follow-ups. So when I think of the work that we do with our clients, we're working with so many clients now on benefits. Is it as simple as coaching those clients to ask at the time of healthcare benefit renewal, to ask if they have, for example, healthcare providers that are comfortable, with transgender colleagues? Is it as simple as saying, what is your BIPOC representation for mental health care providers? Like, is it the power of suggestion? What is the question that our HR benefits colleagues should be asking at those meetings? Or is the question 6 months before the renewal to kind of tee up the urgency? I'm just curious what that takeaway is.
Yeah, I think all these questions are best asked on a repeated basis, not just at renewal time.
Mhm.
And as I said, probably there are relatively few networks that are going to have a much better answer than others.
Mhm.
But if all the networks get the idea that all of us are pushing for this,
Uh-huh.
they will all do what they need to do. So there's definitely power in especially for larger employers that you've got as
Sure.
an individual employer. But as a group of employers, we carry, I think, the greatest weight.
Absolutely. Absolutely. I feel, if we look at anything like seatbelts, like there's just like some things that are automatic and that only happen through countless people saying that this is needed. Okay, fantastic. We're going to switch gears in a moment and go into pay transparency, which is very much on the minds of our compensation colleagues, specifically folks in the New York area who are gearing up for November. But before we dive into that, we'd love to hear from all of you. So a poll is going to pop up in just a moment. We're just so curious just to get a sense. Does your company currently include pay ranges in job postings? Looking to get a sense of what folks are currently doing. Okay. Interesting. Okay, so we have 50, yeah, interesting. So 58% of folks are saying no, with 33% yes. Okay, so the vast majority are a no. So, and again, we could do a whole session on pay transparency, but let's at least address it here with our comp expert, Lori. So, and for those of you who may not be just maybe this isn't top of your inbox because there's a lot in there. Starting in November, pay transparency goes into effect in New York. What does this mean? Job postings for New York-based jobs will have to include the salary range, right? So it's already in effect in 7 states who already have pay transparency laws on the books already across the country. So, states like Connecticut, Nevada, Colorado, California, others. So as a compensation pro, Lori, in what ways do you think this is a good thing? And in what ways is it challenging? And what are the implications for companies who are preparing for this?
Okay, just to clarify too, right now the rule is for New York City, but recently they're talking now for New York State as well. And if that gets signed by the governor, we may see that in March of 2023. So it's here and it's coming. And the New York City rules are perhaps the most expansive. They're on par with what Colorado is doing. The rest of the the laws are really saying you need to tell them after the posting, but before, so you have to tell them at some point in the process, whereas New York and Colorado are right at the start, you have to post those. So those are the most expansive right now. So I've spent a lot of time pondering this because I've been in compensation for a long time. And I think I can come down on both sides with good points and bad points, and then just more kind of talk a little bit about the preparation. So on the good side, I really do embrace any effort to add to pay transparency, to close the gender gap, to increase parity. So that part, I'm a big proponent in clarity in the compensation and for people to understand how they're remunerated. So sharing a good faith minimum and maximum base salary is what this law says you have to do. It doesn't have to be your full ranges, but it has to be a good faith on what you're going to bring the role in at. And I think sharing it right at the outset might save from wasting time of incumbents coming in and finding out the job's not what they want. It may save time on the company from having all these unnecessary interviews when the person is not going to accept the job. And I think it'll educate people better what their worth is. Now, remember, this is only part of the compensation. So there's all types of variable pay and other things too, but at least it's kind of starting to open that door a crack. I think also it's going to make companies really think about what level person do I want to bring into this role? So therefore, where in the range do I want to be bringing somebody in? So it's going to really make them think, instead of just putting an all-out call, they may be more thinking what level they want to bring in and make sure they have the right candidate to get that. Some of the challenges I see and some of the challenges that companies are voicing are that people, seated incumbents might say, why aren't I being paid at the top of the range? And it may kind of start spiraling into this big effort where total rewards people are going to be in the constant state of trying to justify pay to people. So that's a fear that some companies have voiced, that it's going to start a whole ball rolling on people questioning their pay levels. And it also might make people coming in to say, if they're interviewing, saying I should be at the top of the range because I'm bringing this much to the table. So it may take some of the kind of put a little bit more argument into the recruitment process, and maybe you're going to lose some good incumbents that you otherwise would have gotten because the person next door advertised a little bit higher. So those are some fears. And then there's also fears on the diversity front, where it's really meant to protect diversities and bring in equity. There's some companies that are saying, we kind of have a hidden agenda of what we want to pay really strategic hires in the diversity field, and that's going to maybe limit our ability to offer things that may not be in our standard ranges. So that's something that other people have kind of voiced. So those are some of the pluses and minuses, but regardless, I do think it's a good thing. It is barreling down the pike. So I think companies have to get over it and get used to it and kind of start marching along in that direction.
Absolutely.
And so to prepare, some companies, and a lot of my organizations already have some kind of a salary structure in place. So they're able to maybe more easily pivot and start putting in, be able to really address this, easier right off the start, because roles are assigned. And that's a good thing. They still have to build the processes behind on how they're going to, what they're going to show, because they're not going to put out the whole salary range. They're going to put out something that's a good faith estimate.
Right.
But I think they're in a better position. I have actually an Inspire client who, some of their company, they have ranges and some of them they don't. So, they've been working through a process of saying, how am I going to create, some good faith ranges for the jobs that we don't have a salary structure for. And, and as you'd expect, they're going to market and they're figuring out some kind of a blend around market, and also looking at, the experience they're looking for and the skill set, and how to maybe adjust salaries based on what the candidate is bringing to the table. So they're doing a lot of work on that regard.
Time is moving so quickly, especially in these pandemic times. November will be here in a minute. We find ourselves in June. So knowing that for New York City folks, that this is going into effect in November, what is the timing in which you would recommend companies start including the range? Because in the poll, it showed 50+% of folks are not included in the range. What month, what week, when should people start?
I don't really have an answer for that, but they better get their ducks in a row so they can hit it at
Yeah.
at the time. And
Yeah.
I think they need to start doing internal analysis. A lot of companies already do pay equity analysis, but get them fresh and start. So at least when these questions do come up, you're ready to answer them without putting your poor compensation people into a tailspin of, internal analysis.
Exactly. Like we need to show our CFOs some love. We need to show our comp colleagues some love during this time, because it's a tall order if companies do not have muscle already built to do that compensation analysis, to quickly spin all of these things up. I know that that's been a request a bunch of our clients have had, just getting ready for this. Thank you for that. So I want to kind of switch gears. So, there is so much that we're covering. We could do a dedicated panel discussion on so many of these topics. I'd love to hear from all of you. What is one thing that HR leaders can do to make their total rewards offering more attractive and inclusive, ideally leading to greater retention and recruitment, which is on the top of everyone's mind. So Ray, if we could kick it off with you.
Happy to. So I'm going to give you two things, sorry. But those two things are, first, take a look at eligibility requirements. Every eligibility requirement is an exclusion. If you have to achieve some specific thing, then that means there are people who are being left out. Now, that may be intentional. And I'll pick on one as an example: service requirements. Benefits often have service requirements. Sometimes it's just 30 days, sometimes it's 90, it can be as much as a year. And sometimes you can even see 401k programs that have sort of graduated participation levels. I saw data just yesterday that suggests that turnover for Black employees is higher than for white employees, which means if you have eligibility requirements, there is likely to be a disparate impact. Not just that it's possible, it's actually likely. So you need to look at those and decide whether the business value of those, which could be designed to increase retention actually, exceeds the disparate impact for you. And I'll generalize that to say, picking up on a point that Chuck made earlier, take a look at utilization of everything. Who's using it, who's not using it. And if there may be things where it's really not a built-in obstacle for your program, but you're still not getting equal utilization. Look at those things, start thinking about whether there are things you can do to just drive up utilization without making a change, or whether in fact maybe you even need to make a change.
Okay, love it. Hashtag utilization analysis. All right. Who else wants to give us the one thing? And I ask because we always say on these panels that, everyone has so much going on in their inbox. If people can leave with, 1, 2 things during this hour spent together, it's always time well spent. So these are great. I'm already writing notes down on stickies here. Who else would like to offer one thing that HR leaders can do? Lacey?
I will, Jamie.
Yeah.
I'll leverage off of Ray's point. So as a citizen of the Cherokee Nation and a Native American woman who served as CFO for my tribe, I know that connecting our employee base, which was largely comprised of Cherokee citizens, connecting them to our benefits was really difficult. So from convincing them to not just invest their 401k in the stable value fund, to taking advantage of the full portfolio of benefits that we had, it does take some extra hands-on support. So I can just speak for our experience that we know that Native Americans like navigators, and we like to talk to a person. We like a human being that can help us walk through the benefit process so that we can ensure that we get the intended results that are meant by that benefit package.
And in that case, did you have extra staff that could answer questions rather than folks calling a robo number? How did that play out?
We did, and we also invested in some the external white glove service that was offered by the service providers that we'd hired to offer the benefit.
Fantastic. Just to answer those, because these questions are very it's the most personal. So having those humans to answer questions is key. Others.
Yeah, I would certainly suggest when it comes to your financial benefits to really get a handle on who needs what and who is going to benefit most from what. I'll give one easy sort of point solution, and that's emergency savings. There are a couple of really cool platforms that are in development or out to market now that are offering the opportunity for employer match in coordination with payroll. And emergency savings touches all incomes pretty much, except for the executive level. So you're going to have a huge win there from your total employee population, but you're really going to impact your lower and middle income folks by putting in a emergency savings program in place. And so if I had one takeaway, I would get right out there and start looking at those.
Smart. And Lori, any thoughts from you?
Well, mine kind of repeats a lot of the trends you're hearing. I mean, I really think it's don't give your employees the opportunity to be dissatisfied and unhappy with and not understand their pay. I mean, really make sure you have communication efforts in place that can explain it, can try to, and spend time with them when they're dissatisfied. I mean, it spreads like a, fungus. You just want to really nip it in the bud and really get people to understand. They may not agree with it, but if they understand it, at least don't feed that opportunity to get them unhappy with it if all else in the relationship is good.
Absolutely. These things can spread like a virus, right? You want to absolutely address it head on. So next up, I want to talk about salaries. So, I always say we are living in VUCA times, volatile, uncertain, complex, and ambiguous. And it is VUCA. So salaries have been on the rise. And a headline from the Wall Street Journal earlier in 22 was titled, "Tech giants turn to the classic retirement tool, cash." It's like the good old cash thing. And, back in April of 2021, companies were planning to increase their earlier in 21, companies were planning to increase their salary budgets by 3%. But by the time we got to December of 21, most companies were looking at a 3.9% increase. Here we are in 22. Amazon has doubled its maximum pay base to $350,000, and Google, always a leader, has expanded its bonus structure. We are all living in times where we need to keep up with rising rates to recruit and retain the best people. So much to unpack here. I would love to hear, where do you think this trend is going? Companies cannot just continue at this pace, or can they? I know no one knows, but, do you think this economic downturn is coming? And if so, might it reverse this trend of salaries on the rise? So, Lacey, no pressure, but if you could speak for the entire CFO community, I just would love your thoughts on this one.
Well, I think for some professions, particularly like finance and accounting professionals, the trend will only go higher, and the competition will continue to increase for talent there, because when we look at the monetary supply doubling with all of the pandemic stimulus, the demand for financial acumen has doubled, if not tripled, with the supply of money. And I think we're also seeing this for customer service and other hands-on professions that help create that bespoke experience that people are craving. Just yesterday we saw an article about how people are still going out to restaurants, even if there's 25% cost increases, simply because this is what people are craving, and particularly after we're coming out of our holes from a pandemic. And so I do think there will be a cooling off period where salaries will have gotten unsustainably high, and just we're going to have to remember that in this recession, consumers of our products and services may not have that loose discretionary income in cash that they have had in recent years, particularly again with all the stimulus influx.
I think that example from the restaurant jumps out at me. We did a shopping run yesterday, and my husband got back in the car and he's like, "James, I just paid like $7 for, those big things of like fava Greek yogurt." He's like, "They're usually like $5.50, but our family's addicted to this. It's the little things, like we got to like hold on to whatever we can in these pandemic times." And for, the clients, it's the Greek yogurt. So here, everybody's got their thing. It does feel like it's more expensive to do our day. Yeah. Lori, thoughts from you?
Unmuted. There we go.
Okay, there we go.
And actually, I've seen all those same things, the salaries increasing, and they are. But actually, just the other day, interestingly enough, I'm not disputing all the noise that's out there with this, that's certainly happening. But just the other day, I saw an article that said that some of these large companies are looking to do layoffs. So I think some of them were like Tesla and PayPal and Netflix. So, what's happening there? So, maybe the tide is turning a little bit. But with some of my clients, I guess where I'm noticing the most pain, I guess with some of my clients are those that have people on the front line, and like with the restaurant and the service
Mhm.
industries. I have some clients that, they have customer service people that have to go into work. They can't be remote, or
Mhm.
you know, they're medical, like outpatient medical, and they have to go into
Sure.
the office.
Sure.
And the companies are experiencing, I mean, they've always had high turnover in these roles, but it's just, it's off the charts right now, and they're
Right.
losing people and they can't get people. And the expenses are real. They're the most vulnerable because they're the ones living, in hourly pay. And so one of my clients is actually exploring their costing out, just how to get some money in their hands. And they're looking at giving them gas cards, like on, monthly or bi-monthly gas cards to help them
Mhm.
out to recognize the price of gas, because they have to come into the
Mhm.
office, or for people that have to drive, some of their like regional managers to increase their auto allowances just to
Mhm.
get some cash in their hands.
Mhm. It's
And I
really
think some,
innovative. Oh, I was just
yeah,
saying, it's a really innovative idea. Yeah.
yeah, and also I think some of the Inspire clients are looking at maybe providing pay increases instead of an annual, maybe to do it
Mhm.
more frequently than annual,
Mhm.
just to get some cash in people's hands
Mhm.
a little bit faster.
Mhm.
But it's interesting too. And I think, how is this with these spiraling costs? How is that going to
Yeah.
affect it? I mean, certainly budget wise, it's going to impact things. But I also think everybody compares their salaries against somebody else, and if everybody's are going up, they're still kind of philosophically paying at the same point versus their competition. And so, kind of like a rising tide floats all boats. So
Yeah.
at some point it's got to end, but right now, I mean, people are still trying to keep up with the Joneses. So
Absolutely. Absolutely. But,
yeah.
it's interesting what you said, earlier about so many organizations, Carvana, to add to the list, have announced that they're doing um, these reductions in force are being planned. And so you do wonder if over time there will be kind of like there was a housing bubble, like if there will be a talent bubble, and these rising salaries will slow. So we've seen everything during this volatile time. So we will put on our seatbelts for what is next. But I think what we always go back to is all that we can control during these VUCA times is just preparation, right? It's almost like having the various scenarios ready for if you need to continue on the salary increase journey, which is what we've seen in the last 12 months, or for other clients of ours, which you mentioned, they're starting to think about potential RIF preparation. So it's about just getting preparation for those different scenarios, because we're not quite sure what the next chapter brings. I'd love to launch another poll if we can, and hear about how your organizations are adjusting for salary or benefit offerings based on employees being hybrid, in person, or remote. I know this is on the top of mind for lots of folks. I was with a friend over the weekend who's a physician, and she said that they have now announced that if any of the physicians in their hospital are going to work remote only, salaries will decrease by 80%. And I thought that was a really interesting data point, because who knew? But so much medical care could happen virtually during the pandemic, but now they very much want folks to be back in. So I thought that was an interesting data point. All right, so here we go. So, wow, 71% said that there is not an adjustment based on how folks are working. Okay, really interesting. Okay, so obviously we're going to have a whole variety of situations based on industry, et cetera. So I would love to think this through. So, and again, we get this question all the time. So how, what are your thoughts on how total reward considerations shift, based on primarily working in person versus hybrid versus remote, and are there any unique considerations that folks should take into account for these different models? So Lori, as our resident comp expert, if we could kick it off with you.
Okay. I mean, like doing geographic differentials is something that was very common. It still is very common, but now with the remote and the hybrid and the in-person, it kind of muddles some of that, and companies are still kind of floundering around a little bit. And I guess the poll is a little surprising that 71% said they're not doing anything. So that's a bit of an eye opener, but I kind of been mulling around ideas in my own brain. So, it's not, I can't say that this is the way it should be, but it's kind of seems reasonable to me. And I don't know if anybody seems reasonable to anybody else, but I think it matters. Like, is this job permanently remote? Is this job permanently in person? Is it a hybrid? Because I think the way you want to pay somebody, if they really have to be either at an office or near an office so they can get there, then, to pay them based, if it's a high cost area, maybe that does make sense to, maybe it's not the salary anymore, maybe it's a premium, maybe you need to change that balance a little bit. But if somebody needs to be near a high cost area, then that I think is one argument to pay them appropriately. But then maybe the other argument, if somebody can be 100% remote, then who cares if they're living in the Silicon Valley or Iowa? Maybe you're paying them on a national scale instead of a Silicon Valley scale. So, I mean, this is just kind of concepts I'm still kind of thinking about, but, I think it's depending on the needs of the company and where people need to be versus where they want to be.
Yeah. And I think such a good point. And I think I might have misspoken. My friend, I was telling her about this panel cleanup. She was saying that I might have misworded, that they're paying 80% of what they normally would pay. So if you're did I say that earlier? I'm not sure. I think, yeah. It's like if a physician, for example, got 100, but they said, you know what, I don't want to commute into Midtown Manhattan. I'm going to stay at my home in Woodstock, New York, that they would get 80%. So it's like, I think that, the West Coast has always kind of set the tone. And was it Meta summer of 2020, who was then called Facebook, said that they would be looking at what salaries were paid based on remote versus hybrid, et cetera. And they, there's always a ripple effect when those big tech firms speak. So I think there also is a sense that folks thought that this felt all sorts of temporary, that we would be in this hybrid state, right? Folks were going to come back. What was it? Labor Day last year, then it was, after Halloween, then it was Gen 1, and then Omicron happened. So I think, my sense is this is just kind of how it's going to be for the foreseeable future. So anyone who's waiting for like this moment to say, and yes, we can all now without question, without hesitation, return to pre-pandemic, I don't think that that's really the modern way to look at it. So I'm just so fascinated to think about the fact that so many comp experts have had these various scenario playbooks, and the one that was the hybrid, I think, is the playbook that has to be used, because that's kind of how we'll be for a bit. Chuck, any thoughts from you on this?
Yeah, I mean, so my firm is, we're back 3 days, and the message is 3 days is good, 4 days is better, 5 days is best. There's no sign that there's going to be any sort of adjustments in compensation, but I do think it's market driven, right? So, one of our competitors I know has been very outspoken about, if you're not working in New York, you're not getting New York money. And there's some merit to that. I mean, people commuting into Manhattan are, anywhere from $15 to $50 a day just for that.
Sure.
And then, you include meals and things like that. So, but then there's, some of our competitors that are going to 100% remote, and we're going to find out soon. Are we going to lose talent over, the changes, the adjustments? And let's not forget too, and I'm speaking industry specific, but my industry has been spending a lot of time and money on technology people. And so they're going to have to be responsive to the fact that if we want to bring engineers over from Google or Meta in New York, I don't know that, we'll just see how that plays out.
Yeah, absolutely.
But I think there's probably more financial services firms that are considering or are implementing changes in pay based on whether or not you actually work on Wall Street. So
yeah, it'll be interesting if we were to redo this panel in June of 23 to kind of see where all of our organizations were, because if you told me a year ago that this would not be solved, I wouldn't have believed it. But here we are, right? With all these variants, we're still in this limbo mode. Yep. So speaking of this pandemic of ours, as you know, we are obsessed with self-care for the HR community. So we love to always hear from our panelists what they are doing for self-care during these times. And if folks in the chat want to share what they're doing, we're always thrilled to get new and innovative ideas. So Lacey, if I can start with you.
Cardio, tennis, yoga, and going to bed early.
Love it. And can I ask, what is your hack to make sure that you get to bed early, and how many hours of sleep are you getting?
I just get really tired around 9:30, and I typically get at least 8 hours of sleep.
Amazing. Amazing. All right, Chuck.
So a few years ago, I found that the best thing for my emotional well-being is powerlifting. Not a sport that many 45-year-olds take up, and 6 years later, I'm still doing it. I'm finding that it is my self-care. If I'm not doing it, I feel it. I can hear the crazies start to creep up, and so yeah, that's it's tough to have a bad day when it starts with lifting heavy weight.
Amazing. May I ask what kind of weights are you up to at this point?
So I squat. My maximum squat is a little over 400 pounds. My deadlift's a little bit more than that. And for a little guy like me who just started this, it's pretty fun.
That's amazing. Oh
Yeah.
my God, I love it. All right, Lori, down to Florida. Over to you.
I have to say the powerlifting does not inspire me, but sorry.
Amazing.
I'm a little bit of a workaholic, so I have to kind of squeeze my relaxation in. But I live in a community that we have a really big lake, and to get around the lake, it's about a 4-mile walk. So I try to walk the lake as much as I can. And then also, I tend to meet some friends. We're big on the Cuban coffee and all those little cafes down here. So sometimes late at night, I know having a big jolt of ultra caffeinated coffee doesn't sound very relaxing, but I do go out and have a cup of coffee, a cup of Cuban coffee, a cortadito with friends sometimes to just kind of decompress and, and just be with people.
I love it. I love it. And Ray, what is going on in your world for self-care?
Yes, I'm not powerlifting either, but I, like Lori, like to go for a walk. I get a lot of enjoyment out of that. It's a great reset. I read. I tend to read a lot of nonfiction, and of late, I've noticed that I need to read a little bit more light stuff because I've been reading some pretty heavy stuff, as a couple of you know.
Yes.
But this year, at least, watching the Mets is
Nice.
at least a lighthearted thing that I actually love to do with my boys, just sitting on the couch.
Oh, I love it. I love it. Oh, all good stuff. I just got a couple of new ideas here. All right. So we are going to go to the Q&A portion in our last 10 minutes. If folks have any questions, I've already seen a bunch come in the chat, a bunch were sent in advance. Please go ahead and pop those in. All right. First up, what do you think the average merit budget will look like in 2023? And how will current high inflation rates be factored into year-end bonuses and pay increases? So, Lacey, do you want to take that one?
So the average merit budget and how will inflation be taken into? So that's, I don't think I could give an exact answer on that because every company is going to have a different way of looking at merit and how they're going to deal with inflation in general. But I would say that it is going to be imperative for every company to look at to have these conversations, just as I said earlier, right? To have the transparent conversation going on between the CFO and the CHRO so that you both know where each other's challenges and pain points are, and also how profitable the company is or is not. So I think when you start having those conversations, you'll start to find what the right size budget is for your particular company and industry.
Okay. All right, great. I know this is a speed round here. Lori, any thoughts from you on that?
Some of the market data I've seen have been predicting. I know it went from a 3% to a 3.9, and I've actually started seeing numbers of 4.9 on average. Obviously, it depends on the industry and the level, but the numbers have been going up for merit budgets, at least according to the salary surveys that are, the pay surveys that are out there.
Okay, helpful. Okay, thank you for that. All right, next up, and Chuck, I think this one will be for you first. Could you share some examples of savings programs that do help with goals beyond the 401k? So for example, first-time home ownership or caring for loved ones. You mentioned those. Anything else? Any other examples?
Yeah, I mean, so a comprehensive financial wellness platform is going to, isolate the different areas of savings. I think all of that should come with some sort of a coach, like someone that you can talk to about what your goals are. And I'm going back to there aren't any point solutions that are specific to any one of those, but there are many platforms that are all encompassing. There's still the only really, the point solution that I'm seeing out there that I think everybody could benefit from is still emergency savings, because
Mhm.
even people that are focused on first-time home ownership, you're not going to want to get derailed by an emergency
Yep.
that you haven't funded for. So
Really
um,
interesting. Okay, really good idea. Ray, do you have any thoughts to add to that about, inclusive benefit resources and programs that you like these days that people should be keeping in mind?
There is just no shortage. It's what I would call a target-rich environment. I would say step back and think about what your broad DEI strategy is.
Mhm.
Some organizations, for example, are leaning into education. Some organizations may be leaning into specific groups because that's tied into their business or some other value of the organization.
Mhm.
Look at that and see how your benefit strategy can support your DEI strategy. I will
Okay,
mention one other thing that I'll put in the chat, which is
please.
we've got a community of interest called WELLY,
Oh,
which stands
yeah,
for Well-Being, Inclusion, and Equity. Entirely non-commercial. There's no money changing hands anywhere. Great speakers, great discussions. I'll put a link in it
please.
to it in the chat.
Please, thank you. Again, no one should be up nights and weekends figuring these things out alone. So thank you. Lori, I think this one's going to be for you. How do pay transparency laws affect remote job postings where candidates may come from New York City or come from Colorado, but the company is not headquartered in one of those places?
My understanding of the law is if the job can be done in New York, either in person or remotely, then it is covered by the New York City pay transparency laws.
Okay.
It covers companies with 4 employees, and only really the company doesn't have to be headquartered in New York, but maybe 1 employee is there. So it's pretty, expansive. I mean, I think a lot of companies are saying, let me just do it for everybody because
Yeah.
it's going to hit eventually anyway.
Absolutely. It reminds me of when there was the wave of the anti-harassment training being required. It was like you knew that your state was going to be requiring it soon. So many companies leaned into doing it proactively. Okay, thank you, Lori. Next up, how can we go about creating pay equity between current employees and new hires when we have limited budget? Lori, do you want to take a stab at that one?
Well, it's the age-old compression issue.
Yes, exactly.
I don't have too many clients that do that, but I have some. I mean, sometimes they'll look at the role coming in. So if they have to hire them higher, then they'll figure out how long that person's been, what their performance is, and they'll do a study and say, we're going to move this person's salary, this much to try to prevent the compression or try to mitigate the compression a bit. So I don't know if too many companies are doing it as a full program. A couple, but a lot of people just try to resolve it as it comes in. But I think it's a good idea to have a process in place because it comes up and people more and more share what they're making. So, and now with transparency, they're going to know. So
Absolutely. I always say sunlight is the best disinfectant, right? So just to kind of be transparent from go, it can save the headaches of not being able to retain folks who don't feel honored when they find out about it through other ways. Okay. The news about high salaries and big increases seem to be centered around tech companies. Do you think other industries will also follow suit?
I mean, as I mentioned, in the financial services industry, we're hiring more engineers than anything.
Mhm.
So I don't think that's very different for a lot of companies that the tech salaries are going to drive salaries everywhere because almost every industry is dependent on engineers. Jamie, I just wanted to clarify something from
Please.
before.
Yeah.
The question probably, as I thought about it after, arose from financial wellness being provided by 401k plan vendors. And I don't want to take a shot there, but that financial wellness offerings from a 401k plan vendor is likely going to be focused on driving higher participation in the 401k plan.
Right.
So what I was alluding to is a separate financial wellness platform that isn't connected to the 401k plan is going to address all those other issues. So
absolutely. That has more of a holistic, unbiased
Yep.
view. Understood. Yeah. Thank you for clarifying that. Definitely.
Yep.
Next up, the news about how does the emergence of national versus regional salaries impact pay equity? Any thoughts on that?
Well, I'll take a stab. I don't know how it's kind of the age old question. It's I was having a conversation with a friend of mine who's in a global financial services company the other day, and his organization just published their ranges for his role, and he was really upset to find out that being in South Florida, that his ranges were, substantially less than the New York metro area. As a comp professional and a friend, I tried to explain what I thought the reasoning was without being familiar with the company, and he was still pretty upset. He felt he was doing the same level of work or even more, and why should he be paid less? And I understand it, but it's also, I didn't really have an answer other than try to explain why it is that way. But
it's tricky. It's definitely tricky. And but thank you. I think time for one more question. So this one I think is coming for Ray. What are some emerging trends and benefits that we should keep an eye on? And what are the most inclusive companies offering that may not be standard now, but will hopefully become more popular?
Terrific question. The definition of a terrific question is a question for which one does not have a ready answer. One of the things that I found interesting as I was doing some recent research is that what I would call the definition of a benefits family is continuing to evolve. So I can think of one company many years ago, I don't know if they still do this, was willing to cover for benefits anybody living with you in the same house, which is a very expansive definition. Obviously, we've had expansion to domestic partners, but I think considering other relationships in people's lives is an emerging long-term trend. We know that lots of couples are choosing not to marry, so the traditional idea of a husband or a wife or a spouse may not be as relevant for many people, but like intentionally, people may just not be committed to that. But think more broadly about that. Think about adoptive children. Think about children who are older than children that you might have thought about in terms of benefits coverage earlier. ACA obviously redefined that to push it up to age 26. I think that question of who is eligible to be covered is continuing to broaden, and is an important long-term trend.
Love it. Thank you. Thank you. This brings us to the top of the hour. Thank you so much for joining. Again, you can always catch our past sessions on our website, Inspire Human Resources, or you can catch us. You can download our podcast. It's called Inspired, and it's wherever you get your podcast from. Thank you. Big thanks to Ray, Lacey, Chuck, and Lori. You were all sensational, and I know we all learned a lot. We are going to pause on doing these panels in the months of July and August to give all of you a chance to recharge, and we look forward to seeing you back in September. Thank you again. Be well and take good care. Bye-bye.